I'd like to introduce Dr. Samir Anwar, who's a rehabilitation specialist. I suppose the first question we've got to ask is, what is a rehabilitation specialist?
A rehabilitation specialist is a doctor who specializes in the physical and rehabilitation aspects of disabilities, and not only looking at the physical side of things, but having a more holistic approach. So that includes looking at the psychological aspects of the disability being acquired, adjustment issues, also looking at return to work, return to leisure activities, sexuality, and life roles in general, aiming at maximizing recovery and improving the quality of life.
So how would I find a rehabilitation physician if I required one?
Usually, rehabilitation physicians work within a rehabilitation environment, like special rehabilitation wards in big general hospitals, or indeed in a standalone rehabilitation centers. There are a number of such centers around the country in New Zealand and in all the countries of the world. And accessing the services of the rehabilitation physician and indeed the rehabilitation center or team in general is done through a referral system, either from the acute surgical or medical wards or from the primary care physicians or other health professionals in the community.
You mentioned a rehabilitation team. What do you mean by a team?
Well, this is a unique aspect of the specialty. It's done in a teamwork. The rehabilitation physician cannot on his own or her own conduct the rehabilitation process. It involves a big team of therapists, and that includes physiotherapists, occupational therapists, speech therapists, and a lot of other professionals in this field.
So in the rehabilitation process, do I have to be an outpatient? So can I just come and visit you and go back home, or do I have to actually go and stay inside a hospital for a while?
Well, it depends on the nature of the disability. There are certain disabilities that need intensive inpatient rehabilitation immediately after the acute stage. However, if the disabilities are not significantly impacting on the patient's function in the community, then they can come as outpatients, or indeed they can receive the rehabilitation out in the community itself. That is to say, services at home.
So if I visit a rehabilitation centre, I've had a stroke, what would I expect to happen?
Well, you will go through a process of assessment initially to look at the current level of function, what are the deficits, what are the problems. The patient is usually assessed by all the team members, so that includes the doctor, the physiotherapist, the occupational therapist, the speech therapist, the nurses, social workers, etc., and I can elaborate on these special therapist activities. However, the most important aspect of this initial process of assessment is to look at the goals that this particular patient and or his family or her family are looking to achieve. Once these goals have been set, then that enables the rehabilitation team to actually organize the rehabilitation process in such a way that it is targeting those goals and helping the patient to achieve them and successfully being discharged home.
I've heard that it's important that I get rehabilitation early after my stroke. Why is that?
Well, the main issue here is that the early rehabilitation interventions, the better. Studies have been shown that recovery occurs at a fast rate in the early weeks after acquiring a stroke, and we want to make good use of this recovery period by intensifying the rehabilitation input, hence maximizing the outcome.
So how long does it take to improve after a stroke, and will I return to my physical function that I was at before I had my stroke?
Well, that depends on the severity and intensity of the initial stroke, where the stroke is located in the brain, the presence of other comorbidities, we call them, or other medical conditions like heart condition or lung condition that interferes with the rehabilitation process, or indeed psychological issues. But generally speaking, patients can improve if they don't have a significant deficits to start with in a couple of weeks, for example. But if they have more significant deficits, it might take them few weeks, and indeed sometimes it can take few months. However, research has shown that stroke clients, even with severe or dense stroke, can recover over years, albeit at a slower pace.
What advice do you have for living with a disability as a result of a stroke?
Having gone through the rehabilitation process and hopefully gained a good degree of independence in mobility and activities of daily living, the majority of clients or patients should be able to go back to normal life activities, normal life roles, whether in the family or return to work, albeit you might have to look at cutting down on the number of hours or looking at job alternatives in some cases. Also assuming other life roles like leisure activities, hobbies, sexuality, and all these issues should be achievable.
What advice do you have for living with a disability as a result of a stroke?
Having gone through the rehabilitation process and hopefully gained a good degree of independence in mobility and activities of daily living, the majority of clients or patients should be able to go back to normal life activities, normal life roles, whether in the family or return to work, albeit you might have to look at cutting down on the number of hours or looking at job alternatives in some cases. Also assuming other life roles like leisure activities, hobbies, sexuality, and all these issues should be achievable.
After I've had a stroke, can I go back and drive the car?
It depends on the country you live in. In New Zealand, there is a 1 month step down, by law. After acquiring a stroke, you're not allowed to drive for 1 month. After that, it depends on the degree of recovery. If the patient has recovered well enough, and that is assessed by the treating doctor or the occupational therapist, then they are allowed to go back to driving. In some instances, an on-the-road driving assessment might be required before the client is allowed to drive again.
And what about sexual activity? Can I regain my normal sexual activity that I had before my stroke?
After acquiring a stroke, there is a high incidence of sexual dysfunction. That can be due to a combination of reasons. For example, medication side effects. These are quite common. Psychological aspects, fear of having another stroke, or communication difficulties between the partners. But these are all not big hurdles against resuming sexual activity, which should be the goal, and just some education and counseling might be required to achieve that.
Why is it important to remain active after I've had my stroke as part of my rehabilitation?
Well, being inactive increases your chance of having a stroke. Research has shown that physical inactivity can be a risk factor for developing a stroke in the first place. If you increase your physical activities, then your chances of getting one is decreased. So indeed, if after acquiring a stroke, you have gained good degree of physical independence and mobility, then a graduated exercise supervised by the physiotherapist should be the goal.
I've heard the term use it or lose it. Does that apply to rehabilitation?
Well, it's important that we try and improve the regain of function, of use of the affected part of the body. It's not a matter of use it or lose it. Sometimes it's quite difficult to regain function.
Sure.
But with the help of the rehabilitation team intervention, hopefully the function and use of that affected part of the body should gradually improve. Once that happens, actually using the affected part more and more in everyday activities give you better outcomes.
And what about speech language therapists?
Well, speech therapists concentrate on two aspects. The speech part of it, which is trying to improve any difficulties with speech, which could be just slurring of speech, or it could be more more difficult part of speech deficits like inability to understand spoken words or actually to produce spoken words. The other aspect of the speech therapist is to look at the swallowing mechanism and the safety of the swallowing, trying to make sure that the mechanism is right and try to help patient achieve that. Otherwise, it can be a problem in terms of causing chest infections and things like that.
What about an occupational therapist? Are they different to a physiotherapist?
Well, that's right. They are different. They concentrate more on trying to get independence in the activities of daily living. So things like toileting, dressing, feeding, grooming, showering, that sort of activities. They also can provide patients with adaptive equipments, that's to say gadgets that help patients do their daily living activities in an easier way, like reachers to catch things at a distance, or a wheelchair sometimes can be provided if mobility cannot be achieved independently and safely, and also look at equipments that might need to be provided at home, or indeed some modifications at home to make things easier for the patient and the family.
We've discussed the important role that therapists play, such as physiotherapists, occupational therapists, and speech and language therapists. Are there anybody else who's involved in your team?
Yes, there are a number of other therapists that are equally important. For example, the rehabilitation nurses, who beside their well-known important role as nurses, but in the rehabilitation field they also assume other roles like managing bowel and bladder difficulties after stroke, incorporating the functional gains that the patients are making from the therapy into their daily routine of activities, also providing education to the patient and their families about the stroke itself, the outcomes and prevention, etc. Other important team members could be the social workers, who play an important role. As you know, there is a huge change in life roles in some of the stroke clients. So they help the patient and their families to look at things like income supplementation through applying for appropriate benefits, for example. Some clients cannot go back to their previous house because, for example, it's upstairs and downstairs and the living is upstairs, so they might need to move into a different house. So helping in application through housing corporation, also helping the family to adjust to the difficulties and dealing with external agencies like appropriate funding for placement in residential care, or the provision of home help or personal caregivers as well.
We've discussed the important role that therapists play, such as physiotherapists, occupational therapists, and speech and language therapists. Are there anybody else who's involved in your team?
Yes, there are a number of other therapists that are equally important. For example, the rehabilitation nurses, who beside their well-known important role as nurses, but in the rehabilitation field they also assume other roles like managing bowel and bladder difficulties after stroke, incorporating the functional gains that the patients are making from the therapy into their daily routine of activities, also providing education to the patient and their families about the stroke itself, the outcomes and prevention, etc. Other important team members could be the social workers, who play an important role. As you know, there is a huge change in life roles in some of the stroke clients. So they help the patient and their families to look at things like income supplementation through applying for appropriate benefits, for example. Some clients cannot go back to their previous house because, for example, it's upstairs and downstairs and the living is upstairs, so they might need to move into a different house. So helping in application through housing corporation, also helping the family to adjust to the difficulties and dealing with external agencies like appropriate funding for placement in residential care, or the provision of home help or personal caregivers as well.
What is home help?
Well, home help, if patient is, for example, living on his own or her own, and they have recovered to such a degree that they can live on their own. However, they cannot participate in heavy domestic chores. So home help are people that help achieve those roles while the patient can continue to live in the community. So that enables them to continue to live there with the appropriate help needed.
You mentioned a team approach to rehabilitation. There were a lot of different people with different jobs helping people recover from stroke. Can you explain a little bit more about what these people actually do?
Right. Well, as I mentioned earlier, the rehabilitation team works as a team, as a group of therapists directing their attention to the patient, trying to achieve the patient's own goals. We tend to have a holistic look at the process and hence involve all these various team members. For example, the physiotherapists pay special attention to mobility issues like transferring from bed to chair, regaining balance, regaining walking ability. Initially, that might have to be aided by certain equipments like stick or a frame, but hopefully eventually walking independently.
Thank you very much.
Thank you.